Hello, 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 everyone. Welcome to another edition of Ask Dr. Dansinger with Dr. Michael Dansinger. He's a world-renowned diabetes reversal expert. He practices out of Massachusetts, but he has certifications to practice as well in Vermont. Is that Vermont? Did I just get it?
New,
Virginia.
New
Started with a V.
Hampshire, Virginia, Florida, Minnesota, New York State.
Oh, all of the above. Oh my goodness. So if you have Medicare plans, if you have a Medicare Advantage PPO plan, it is covered. His diabetes reversal program is actually covered by insurance. So definitely check it out at diabetesreversalpartners.com for more information on that. But he is generous with his time, donating it every single week for an amazing group of PAD warriors across the global PAD associations network. And so many patients, Dr. Danziger, have been sending in so many questions. But before we get to the questions, any opening thoughts, anything on your mind this week before we dive on in?
I'll just say, it's true. I donate my time every week because I'm inspired by the work you do and by the people whose lives you've touched and who contribute to the PAD community. So I'm here for everyone.
It means so much to us. And gosh, we had more than a dozen questions that came in this week, and we still have a live studio audience here for people who are watching via YouTube right now. You can always email info at padhelp.org, padhelp.org, if you want to be in our live studio audience. But of course, we'll check in on YouTube if you have any questions or insights that you want to share during this time. We're here every single week for you. But we had a bunch of questions come in, Dr. Danziger. Let's jump right into the first one. Hey, Dr. Danziger, I've been on insulin for my type 2 diabetes for about 3 years. Is it actually possible to get off it completely just by changing what I eat? What has worked for your patients to wean off the insulin?
Great question. So the short answer is yes, it is possible. And I do have many patients who have been able to discontinue their insulin. And I wish it was easy. And the fact is that not everybody can achieve that. But a lot of people do have the potential to discontinue their insulin under the right circumstances. So these people need to have enough pancreas beta cell insulin producing capacity, and so measuring insulin in the blood when fasting is can give clues about that. When the diabetes is more recent, or when the insulin started more recently, if the insulin's at a lower rather than a higher dose, that helps. If the patient has weight to lose, all those things are in their favor. And so my patients who've been able to discontinue insulin have been, and sometimes it takes 3 months, sometimes it takes 3 years. And it's all about finding the right eating strategy for that person, getting enough exercise, being strategic about about it, and being persistent. And so we'll talk more about how one can eat for that. But the short answer is yes. I would say um, around 25% of my patients who've been on insulin have actually been able to come off of insulin if they are very strict and follow my guidance very closely.
And so you answered some of the next question, which was, Dr. D, my endocrinologist said I may be able to reduce my insulin with diet changes, but how long would that take? Are we talking months or years? And you're saying it could be 3 months, it could be 3 years. It just depends on the person and
Yes,
how diligent they are in following the strict dietary guidelines.
yes, that's right. And when patients, almost all of my patients are able to improve their hemoglobin A1C, within 3 months, just by eating right and exercising and, doing other things to improve their health. Um, and yes, that so even if a patient isn't able to um, discontinue their medications, many patients are able to show blood sugar improvements and, in many cases, reduce their medication, even if they're not able to eliminate it.
And you mentioned we were going to get into diet, and that's where we're going right now because quick question is what this patient says. Just a quick question, but
Yeah.
I don't think it's very quick. Might be a quick question, but I think it's a
Yeah.
more involved answer. Are there certain food combinations I should be eating that would help keep my blood sugar more stable? I'm trying to use less insulin for my type 2.
Yes. So almost all the patients I work with are able to reduce their insulin dose, even if they're not able to fully eliminate it. And we do that through, strategic eating. And it's mainly about pushing up the protein while decreasing the total carbohydrate intake. So that's my number one strategy for doing that. And you want to have the right amount of protein, not too little and not too much, because I love protein because it doesn't raise blood sugar, but it's very satiating. And so it's good for weight loss. It's good for maintaining and building muscle. It's most people like protein foods. And even if you're on a vegetarian diet, there's, vegetarian protein sources that can work very well, like egg whites and tofu, for example. And for non-vegetarians, I really favor fish and shellfish, lean poultry. And so getting your carbs mainly from low carb vegetables and from moderate amount of fruits, and then combining that with healthy proteins and healthy fats is really the way to go.
We did have an extra question that had come in, which I didn't get a chance to include, and it came in last minute, but it seems so fitting, is um, about protein and how to get enough protein in the morning, because this patient says that she usually does not like to eat in the morning, but she's been told by her doctor that she should start eating in the morning. It would help her diabetes a lot, and that it should contain a lot of protein, but she doesn't really like eggs.
Yeah. So breakfast and protein breakfast, it needs to be individualized. Some people are doing intermittent fasting, which we can talk about more, where they're benefiting because they're not eating, until noon. But protein breakfast, eggs are a favorite, but also um, Greek yogurt or low fat cottage cheese can be winners. And there, in many foreign countries, they actually eat fish for breakfast. It could be smoked salmon, but it could just be regular salmon. Some people are able to eat eggs, maybe not scrambled or hard boiled, but as a crustless quiche. And then, cheese has a moderate amount of protein and fat. And so low fat cheeses can also work. I would love to hear any other ideas about breakfast proteins.
So I have a breakfast pudding, and for people who don't like eggs,
Hmm.
it might sound weird, Dr. D, but take a whole egg and cool it off in the fridge. And then you put it in a blender with some raw cacao. Your favorite, I use a little bit of agave, but I know that you suggest using stevia. You could also put in half a banana in there, and you can I put in a tiny bit of water with, a few walnuts in there to mix a little bit of walnut milk, and then add a little bit of avocado, and it makes and you can add some chia seeds even, and it makes a little pudding for the morning.
Yes. So the egg
You have
that
to
you
get the portions right for the flavor, but you can hide that egg in that pudding and you don't even taste it.
is that a hard boiled egg you're talking about?
Hard-boiled egg. I know.
Yeah.
Surprising. Shocked the heck out of me.
That
I
is
didn't believe it.
another, of course, there's protein shakes, which I had meant to say. So many people who aren't in the mood for eggs are happy enough to drink a protein shake, chocolate, vanilla, strawberry, or there's dozens of flavors out there if you hunt them down.
Just watch the sugar, right?
Yes, they're all sweetened, and you need to know and have chosen specifically what sweetener is being used.
What do you think about the peanut butter protein powder, which is just dried peanut butter, like
Yeah,
dried
so there's
peanut?
brands like PB2 or PB Fit.
Yeah,
Some of them have
yeah,
sugar added and some don't.
yeah.
And
Mine
so
doesn't.
so be aware of
Yeah.
whether there's sugar added. You'd want the kind that doesn't. And peanut protein, that's pretty good, I think. I love the taste of peanuts and um when you use, I mean, I like peanut butter too, but the defatted protein powder can or peanut powder can work really really well, and it does have a little bit of carbohydrate in there, but it's mostly protein, and if it's fat free, and so yeah, I recommend that. It's a great idea.
So you mentioned intermittent fasting, and so I want to jump to that one. I've been hearing a lot of intermittent fasting, that intermittent fasting helps with diabetes. This patient is asking, could that help me cut down on insulin as well? Kind of scared to try it with my meds, though, is what she says.
Yeah. So intermittent fasting, we're hearing more and more about it. And you're correct to have, be cautious about it. And so this for intermittent fasting, it's the kind of thing you definitely would do under your doctor's supervision, your healthcare supervision. You don't do it just because you heard it on the internet or because I was talking about it. So especially if, for people who are on insulin, then it becomes really tricky. And so it usually means adjusting the timing of the insulin or not even going into intermittent fasting. But there's different versions of intermittent fasting. And the most common version is when a person stops eating after, let's say, 8 p.m., for example, or some other time they choose, and then they don't eat breakfast until maybe the kitchen is closed from 8 p.m. to noon, for example, or different variations on a window. For some people, intermittent fasting means going 12 hours or 24 hours once or twice a week with nothing but water. And for some people, it means they're eating very differently on the weekends than they are on the weekdays. So there's different definitions and styles of intermittent fasting. In the end, what it's doing is causing people to eat less calories just by closing the kitchen sometimes. And so if you're on the type of medicine that's going to lower your blood sugar, too low, you need to approach this with caution and under your doctor's supervision.
Okay, so besides just checking my glucose, is what this patient is asking, what other health numbers should I be keeping track of if I'm trying to get off insulin through diet?
Yes. So
Good
diet is the
question.
main way to get off of insulin, using food as medicine. And it's a very insightful, important question. And so I would say it's 95% about the glucose. You want to, so you said besides glucose, but I'm going to say it's almost all glucose that really matters when you're trying to figure out how to discontinue the insulin. And so doing it with a continuous glucose monitor is that's an invaluable tool. So if you can use a continuous glucose monitor, I mean, everyone who's on insulin qualifies for a continuous glucose monitor. So I can't recommend it highly enough as a tool to help someone decrease and then potentially eliminate their insulin. And so what else would you want to track? Well, your daily carbohydrate intake would be number two. And so you want to know how many carbs you're eating. And so using a food logging program like Lose It or MyFitnessPal or one of the others is very helpful. You want to know your protein grams, your fat grams, your daily calories. And so food logging would be number two after continuous glucose monitoring. And then your exercise. How many steps a day are you getting? And how many minutes a week of cardiovascular and strength training? So those are the main numbers. When it comes to blood tests, by far and away, it's the blood sugar and the hemoglobin A1C that's going to help you know about your insulin needs. So I'll just leave it at that.
And we can get into this more in another one. I was seeing a study that came out there about the gut microbiomes and the impact on insulin resistance and diabetes. So I think that's something that we should take up on a grander fashion, because I don't think that's a 2 minute conversation. Um, and I don't think a lot of regular facilities actually do the advanced testing of stools for a lot of the bacteria or the parasites and things like that, that the researchers that I was looking at just the other day were looking at as being contributing factors in diabetes.
Yeah, let's do a whole another episode about that.
Good. We have opinions, don't we? Good. Yay. So I want to move from type 2 to type 1 because we have a lot of questions that come in and not a lot of time. Dr. Dansinger, I have type 1 and I'm so tired of the blood sugar roller coaster. 1 minute I'm high, the next I'm grabbing anything I can find to avoid passing out. Any tips to make things more stable?
Great question. Well, I sympathize with the roller coaster, and it's common and it often gets worse with each additional year of type 1 diabetes. And type 1 diabetes, of course, the pancreas makes no insulin. And so all of the insulin is coming through um, injections or a pump. And although there's inhaled insulin, but that's a whole nother side topic. So to get off the roller coaster, to level out those blood sugar levels, lifestyle is very important for that. And so it's applying all the things that we're talking about, mainly about type 2 diabetes, about getting the protein level right and the carb load right and the healthy fat intake in balance. And um, many people with type 1 diabetes have kidney damage from high blood sugar, many years of high blood sugar. And so you need to follow the protein guidelines of your endocrinologist and nephrologist. For many people, again, continuous glucose monitoring and working very closely with your endocrinologist and your team is the key to figuring out how to flatten out those roller coasters. And so it's a combination of a consistent eating strategy, something that has the same amount of carbs gradually, eaten over the course of the day, probably smaller meals, smaller amounts of carbohydrate, um, moderate amounts of protein and healthy fats at the same time as the carbohydrate, the timing of the insulin. And for some people, a pump is, an insulin pump is the way off of the roller coaster. And so through persistence, there's a lot of uh, reasons for optimism that one can get off of the roller coaster, but
Yeah.
you have to advocate for yourself and work more closely with your healthcare team to make it a priority.
Okay, so this patient specifically is asking, so when my blood sugar crashes, I always reach for juice or crackers. Are there healthier options that bring me up without causing a huge spike afterwards?
Yeah, and so if your blood sugar is crashing, you need sugar. And my number one recommendation for that is the glucose tablets that you can buy at um, Walgreens, CVS, or any other um, drugstore. And so the reason I like glucose tablets for this purpose, as opposed to juice or soda or
Bread.
raisins, and yeah, so those things do work, but the glucose tablets are better. First of all, they're very portable, right? You can have them in your pocket or purse or glove compartment of your car. So you want them handy. And then, they last a long time. And so I think they're more convenient, but more importantly, those other forms of glucose from food are actually usually in the form of sucrose, which is half glucose, half fructose. And the body does better with the glucose tablets because it's pure glucose. It's absorbed more quickly and it's more predictable and it's kind of pre-dosed. And so usually 3 or 4 of these glucose tablets, and then see how your blood sugar is 15 minutes later. Assume it takes 15 minutes for that to get absorbed, and then you'll see your blood sugar responding. And if it's not where it needs to be, then you can repeat the amount. And with practice, you can get very good at anticipating how many of the glucose tablets you'll truly need. Of course, prevention is worth a pound, an ounce of prevention is worth a pound of cure. And so you want to be able to avoid the scenarios where you're getting low blood sugars in the first place.
Yeah.
But I highly recommend you getting accustomed to the glucose tablets.
This patient is wondering about timing and portion size in terms of creating greater stability. He says, I have type 1 and feel like no matter what or when I eat, my levels are just all over the place. How should I time my meals and what should I include to keep things a little steadier?
Yeah, great question. I think we covered it mostly a couple minutes ago, but I will reiterate. So frequent small meals, let's say every 3 hours or every 4 hours, spreading the same amount of food just differently into half meals, for example. Consistent amount of carbohydrate each time. And so you want to know how many grams that you're aiming for and try for that. No one enjoys doing that kind of work, but it's worth it if it's going to help, keep the blood sugar even. Combining carbs with, choosing your carbs. So you want slowly digested carbohydrates rather than rapidly digested. So low glycemic carbs, the amount of the carbs, pairing that with healthy fats and proteins. These are really my main, and then exercise and getting consistent amounts of exercise. Exercise is almost like, think of it like a better version of a drug that helps stabilize blood sugar. And so being consistent with your exercise and getting some every day.
And you had answered the next question, which was the nutritionist mentioned that eating more fat and protein might help my blood sugar stability with type 1. Is that true or just going to cause other problems? And you literally went through that just now. And you also had mentioned earlier to make sure that you do check with your nephrologist on the amount of protein you should be eating for your body in case you do have chronic kidney disease or end stage renal disease, because that's really important.
Yeah,
So you touched
absolutely. But
on all of that.
I think it's helpful if we take a couple minutes just to think about some of the most successful pairings between carbs and healthy proteins and fats. Kim, I know you have a lot of experience with doing that, so I would love to hear your list of a few favorite pairings, proteins and carbs.
A lot of times, especially for a snack, I'll do 1 egg with an apple. Or if I'm having a half a banana, I'll have a handful of nuts especially almonds, before I have, a piece of fruit. Or even when I'm having, blueberries, one of my favorite combos is crushing up some walnuts with my blueberries and eating that as a snack and just putting a dollop of unsweetened forage or cashew milk yogurt with it. So that's one of my favorite ways in terms of making sure I can eat fruit without, spiking my blood sugar.
Excellent.
Those are good choices.
I think so. Yeah, absolutely.
Good.
Fruit and nuts is always a winner. I like salmon with asparagus. For me,
that's one of my favorites. The wild salmon with asparagus. Oh my goodness. And then I just discovered apricot infused olive oil, natural apricot infused white balsamic olive oil that has the same properties as apple cider vinegar, according to the numbers. They give you all the numbers that go along with it. And just drizzle a little bit over the salmon. Oh my goodness, it is so good. Absolutely delicious. So I don't like a lot of fish flavor. So I try to figure out ways in which I can get more fish down in creative ways to decorate it, to make it taste less fishy. I know wild salmon has less fishy flavor than let's say your favorite swordfish, which I can't even get down, but I still need a little extra something, something. So I have one more question here and then we will leave. We have so many more left. So we're going to move the rest of the next week because I know we're short on time here. But are there any vitamins or supplements that might help my body use insulin better? My type 1 is so hard to manage, even with my pump and even with my diet.
Yeah, so supplements, again, it's one of these issues you'd always want to talk to make sure your healthcare team is okay with it. If supplements work best if your body is depleted in something. So for example, if your body's depleted in magnesium, which you can try to test with blood testing, then magnesium supplements can be helpful. Or um, fish oil can be helpful in certain cases, especially people who don't eat a lot of fish, especially in people with PAD or cardiovascular disease. For neuropathy, diabetic neuropathy, alpha lipoic acid can be helpful in some cases. With some people who have diabetes and they're looking for alternatives to metformin, some people have used berberine for that. And then, so those are the top ones that come to mind right now. And, protein can be considered a supplement as well. And so adding protein powder to your.
Fantastic. We covered a lot in a very short amount of time. We still have about half a dozen more questions that came in this week. I'm sure we're going to get in more questions next week. Make sure to email us at info@padhelp.org to be able to ask your burning questions to Dr. Dansinger. Make sure you do visit diabetesreversalpartners.com. If you live in Massachusetts or New Hampshire, New York or Virginia or Minnesota or Florida, because he is covered, his services, diabetes reversal services are covered. If you are in those states and you have Medicare plans or Medicare Advantage PPO plans, it might be worth checking out so he can help you one-on-one to get the support you need to live a better quality of life. Meantime, don't forget, like the video, subscribe to our channel, and click the little notification button in order to see more great content like this. But we appreciate you again, Dr. Dansinger, for your the generous donation of your time, for always being here for us. And we'll see everyone next week. You could also email your questions to info@padhelp.org, and we will get to them next Monday. But make sure you don't miss a beat. Make sure you do